ain't right.
Over 240 million claims are denied by insurers every single year.
That ain't right.
While we suffer in pain without essential medications, going into debt, Anthem Blue Cross Blue Shield raked in $6.1 billion just last year. That's why a week ago, we sent a letter to CEO Gail Boudreaux requesting a meeting so that she could hear our demands, hear the people. Seems like she was too busy cashing in on our pain to listen to us, the actual members of Blue Cross Blue Shield. Or maybe she was distracted by her $19 million yearly compensation.
That ain't right.
$19 million a year for one person who can't even do her job.
Boo.
And we're here at Anthem because it's the largest insurer in the Blue Cross Blue Shield network, which is the largest network of private insurers in the country. Millions of people like us are insured by Anthem to get their claims denied, making us sick and putting us in debt. So here we are, taking up space, speaking truth to power, when corporations refuse accountability, especially when it comes to our health. We say, fuck that, and
Fuck them.
and show up. We are not going anywhere until you put our care over your profit. Because the powerful organizers here to share their story, even on top of this gorgeous music they're trying to play to drown us out. That's right! Anthem, the whole Cross Shield, we're going to tell them what's what. And we've got an awesome team working to bring Gail down so that she can, let's make sure that she hears us from her ivory tower.
Who are you? Who are you? To decide. To decide. If we live. If we live. If we die. If we die. Who are you? Who are you? To decide. To decide. If we live. If we live. If we die. If we die. Who are you? Who are you? To decide. To decide. If we live. If we live. If we die. If we die. Who are you? Who are you? To decide. To decide. If we live. If we live. If we die. If we die. Who are you? Who are you? To decide. To decide. If we live. If we live. If we die. If we die.
We are here because we are Anthem Blue Cross Blue Shield members. That works for us. And I want to Lynn to tell their story of how they've been harmed by Blue Cross Blue Shield Anthem.
Good morning, and thank you for the music in the background. I never see so many people out with powerful numbers today, fighting to call in unjust and inequitable insurance practices. My name is Rainful. I'm a Hoosier by birth, Hoosier by choice, and Hoosier by the grace of God. I'm a member of Hoosier Action, Indiana's chapter connection to People's Action. Over the past 3 years, during the public health emergency, I have experienced firsthand the impact access to good, easily accessible public health insurance can make on life, and in the summer of 2020, life saw me falling into a pit of despair. That is, being uninsured in the United States. I was on Medicaid, and I was able to see a dentist for the first time in 4 years. I was so relieved to receive the care I've been going without for years. When I asked people what they needed, Medicare for all, the infrastructure is already in place. It is possible. Where this experience gave me hope and relief, I was given news from my time on private health insurance with Anthem. Over the course of 3 years, I had 6 surgeries, 3 with Anthem, 3 with Medicaid. In the fall of 2020, I received a letter from Health, the largest hospital chain in Indiana, saying that I had nearly $2,500 in medical debt not covered by Anthem. I immediately looked at my options to apply for financial aid. After a few months later, I received a letter stating that all of my medical debt with IU Health was not covered by Anthem, would be canceled. I was happy to the point of tears. I would be able to breathe and focus on important matters. 2020 was starting to look up for me. Shortly after that, I received a letter from Harrison Harris, a debt collection agency. I was informed that I had an outstanding debt of nearly $5,000 from Anthem. First 3 surgeries. Don't know what I'd even done. After a few months, thank you for turning it up! Thank you. I was able to find out that IU Health and Anthem secretly worked together to deny coverage, claim forgiveness, all while sending that debt to collections. IU Health and Anthem will never lose. I was scared, I was stressed, and I was angry.
because they're so scared of us, they're afraid we're going to ruin their grass if we step on it. Okay. Okay. Go ahead. You see me? Fist up, follow me. All right.
Who are you?
Who are you?
To decide if we live or if we die. Who are you? To decide if we live or if we die. Who are you? To decide if we live or if we die. Who are you? To decide if we live or if we die. Hold it out. We can see your greedy side!
Hey, Anthem, you can't hide!
We can see your greedy side!
All right! We are continuing our program because we are here to show Anthem, Blue Cross Blue Shield, that when we pull up, we don't stop. Like I was saying, we sent a letter to Gail last week with a series of demands.
White-collar robbers!
We said we demand that Anthem, Blue Cross Blue Shield overturn any denials submitted by care or cost. We said don't deny claims and overturn any existing denials for treatments recommended by medical professionals, by our doctors. We demand transparency around denied claims, pre-authorizations by market, state, geography, race, and gender. What are they doing with our claims and with our money? We want them to share how much money they're making off of denying us our care. That ain't right. And we demand that they hold monthly open mic meetings with policyholders like us to discuss problems with their insurance products. And finally, we demand that they relinquish ownership of and transfer the claim and people's appeal process to relevant public authorities, to the people. What do you think of those? Right. We've got some powerful organizers here to continue to share our stories and speak truth to power. So I'm going to bring my friend Maya up here to share their story. Let's give it up for Maya.
Hello everyone, I'm Maya. You say that pronouns. I've had to fight with Anthem Blue Cross Blue Shield for years to get access to essential migraine medication. When I was 8, I started getting really bad migraines that would start with an aura and would leave me with really bad pain, nausea, fatigue, and so much other stuff. If you've ever had a migraine, you know how hard it is just to do basic tasks. There have been times where I've gone weeks without seeing my friends and I've been isolated because it's so very hard to function. That ain't right!
That ain't right!
I used to take over-the-counter migraine medication to deal with the pain, but I was taking too much of it. So my doctor decided to start prescribing me better medication to help me manage my symptoms. It took years of trying to figure out different medications to try to figure out what would work, because my insurance, Blue Cross Blue Shield, required me to try a bunch of different meds that were cheaper because they didn't want to pay. A year ago, I got a new injectable medicine that actually worked. I felt so relieved and excited. I got the first injection of the new medicine at the doctor's office and was prescribed an injection once a month. In a few months, I had less pain and less frequent migraines. But then, I got a letter from Blue Cross Blue Shield telling me the medication was denied and they would not cover the cost. That ain't right!
That ain't right!
When I looked up the medicine on the Walgreens website, I saw it cost $800 out of pocket, and I thought, holy shit, I can't afford to pay that. This made no sense to me because my doctor sent Blue Cross Blue Shield multiple letters saying that this new medicine was really helping me, and they decided to stop paying for it. That ain't right!
That ain't right!
My doctor and I then spent 4 months fighting with Blue Cross Blue Shield to get my meds covered or see if a similar med would both work and be covered by Blue Cross Blue Shield. After countless phone calls and letters back and forth, it finally was covered. Yeah! But the way the injectable medicine works is that I have to take it every month to prevent migraines. So while I was fighting with Blue Cross Blue Shield, I went 4 months without my medicine working. So they did not stop
That ain't right!
And on top of that, when I started taking the medicine again, it didn't work as well as it had. And since then, I've been in pain every single day.
That ain't right!
If Blue Cross Blue Shield covered the meds my doctor prescribed, I would be able to live my life pain-free, which would make my life so much easier. School would be easier, work would be easier, having fun would just be easier. I wouldn't have to worry about getting sick in public. It shouldn't be like this. That ain't right!
That ain't right!
When my doctor prescribed me medicine, I should be able to have access to that medicine. Blue Cross Blue Shield, I live in daily pain because you put your costs over my care.
That ain't right! Woo! Your greed makes us sick! 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 Your greed makes us sick!
All right, let's give it up for Maya. That ain't right.
That ain't right!
We can cover the meds that our doctors say we need.
Yes!
Now I'm going to bring up Adonis to share their story. Let's hear it for Adonis.
Hello, everybody. Good morning. How's everybody doing? My name is Adonis, and I am a Blue Cross Blue Shield member. I don't know if I'm happy about that. I have been very lucky to not have any chronic conditions as of yet, but that might change soon thanks to the greed of Blue Cross Blue Shield. You see, I am a gay man, and like many gay men, I am on PrEP, pre-exposure prophylaxis. PrEP has worked wonders, and it's helping to control the HIV epidemic. Thanks to PrEP, we can, as gay men, we can now live free of fear of HIV. However, there are many different types of PrEP, and some work differently on your body. And in my case, my doctor had to try different kinds of PrEP to figure out which one worked better with my body. And finally, we found the one that was right for me, the one that was not hurting my liver. Unfortunately,
Blue Cross Blue Shield thinks that I don't need my liver to be healthy. They decided to deny the coverage of the type of PrEP that was not harsh on my liver. And instead, for the last 3 years, I have been taking one of the types of PrEP that is harsh on my liver and is slowly killing my liver.
That ain't right!
Unfortunately, this is not an isolated incident. This is something that a lot of the LGBTQ community has to deal with. And one of the things that angers me so much is that every June during Pride, Blue Cross Blue Shield takes out their pride flags, lights up their buildings with the rainbow, but they do not provide the cover that the LGBTQ community needs.
That ain't right! That ain't right!
I don't need your pride flags. I don't need your parade floats. What I need is for you to cover the care that we need to live long, healthy, and prosperous lives.
That's right!
Blue Cross Blue Shield, we need you to cover our care.
Blue Cross Blue Shield, we need you to cover our care.
Blue Cross
Blue Shield, we need you to cover our care.
Blue Cross Blue Shield, we need you to cover our care.
All right, let's give it up for Adonis! Blue Cross Blue Shield doesn't give a fuck about queer people, and we're here to say that to them to their face. Right. We deserve better. All right, now we're gonna bring up Erica, who's gonna read some comments from our person Bree.
All right, come
Hello, my name is Erica Sawyer. I use she, they pronouns. I'm from Iowa Citizens for Community Improvement.
That's right!
And I am a type 1 diabetic, as is our friend Bree, who is not able to be here today, mainly due to the treatment that Blue Cross Blue Shield Anthem has given her. Bree was supposed to be here to share her story, but because of the insulin pump that she's on, her sugar was out of control yesterday, and she is not feeling well enough to be with us.
That ain't right!
Bree was diagnosed with type 1 diabetes when she was 12, and she's now 34 years old. She's been on Medicaid since she was 26, and whenever she was first put on Medicaid, Iowa was a public Medicaid, and now that it has been privatized in Iowa, her care is now under AmeriGroup, which is under the Anthem umbrella. In spite of Bree being diabetic since it was 2001, using insulin since 2001, AmeriGroup forced her to prove she was type 1 diabetic.
That ain't right!
After that, Humalog and test strips started getting denied. Her endocrinologist would send a letter, send appeals, and she would be able to get her medicine. This happened to her every year, several times a year, since Medicaid was privatized.
That ain't right!
There's needless red tape, there's inefficiencies, and a drain on her time and her experience. Despite all of this, the most egregious thing that she has gone through under AmeriGroup and Anthem, managing her Medicaid, has been trying to get a new insulin pump. I just switched this summer to the insulin pump that Bree is trying to get on. I was on the pump that she's currently on, and that quality of life is indescribable. That is what diabetics deserve to have.
That's right!
That's right!
Bree tried to switch, and Anthem put her on a pump that is out of date.
That ain't right!
She was simply told her insurance wouldn't cover, and they didn't even try to appeal. Didn't even put in the effort to ask, even if she could have gotten a no.
That ain't right!
That ain't right!
Bree is a fighter, and she has pushed back. She's refused to accept that answer. Her and her doctor agree that this is something she needs for her health.
That's right.
Yes.
She called her doctor, and they found out a form does not even exist to try to get on this pump with Medicaid. Amerigroup does not think poor people deserve quality care under their coverage. So after months of precious time on the phone in the doctor's office talking to this insurance company, she is currently still waiting to find out if they can even try to get prior authorization. Even she still might get a no, and then that's the process starting all over again.
That ain't right.
Lots of people just give up because of how difficult this corporation makes it to get our medicine.
That ain't right.
Anthem is treating her less than because she is poor, because she is disabled, because they think they can get more money out of her this way. And they're doing this at the expense of her health and the health of all of us.
Your greed makes us sick.
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 Shout out to Erica for speaking on behalf of Bree. I know I have gone without medication because when I arrived at the pharmacy said Blue Cross Blue Shield will not cover this medication, and so I left without it. And that ain't right.
That ain't right.
I'm going to bring up our next speaker, Kaya, to share their story.
All right,
Thank you all for being here today, right? So my name's Kaya Morris. I use she, her pronouns. I'm the Executive Director for Rights and Democracy in Vermont and New Hampshire. So Rights and Democracy was literally founded on the premise that we were supposed to have health care for all, and it was denied to us after we worked diligently to put people into office to make it a reality.
That ain't
We
right.
walked that back, and we've been fighting ever since.
All right.
So when I'm coming to you here today, I'm thinking about the fact that healthcare is the heart of why we are each trying to make this world a better place, because without our health and our sanctity, we have nothing. There is no one in this country who is not impacted by the cruelty of our for-profit healthcare system. In the worst scenario, you have no insurance, meaning you have an extremely difficult time accessing the care of any kind, that which you deserve, let alone quality care. The better option, as we're told, which is not good either, is one that requires really expensive plans that still don't pay for all of your costs when you actually need them. So we come to this work because of our own personal experiences. My husband has had cardiac issues for over 30 years. He's had 4 heart attacks, 3 stents, triple bypass surgery, 5 strokes, carotid artery surgery. His insurance company made him feel like his health issues were his fault. Because if you only had the right diet, the right exercise, maybe if you lowered your stress, you might survive. And it was clear, though, that his endocrine system was going haywire. But they wouldn't give him the care that he deserves and is entitled to. His medical team knew what the exact treatment was that he needed. An injectable form called Repatha that would help to manage his cholesterol levels, which they had not been able to control with any other of the methods they put on his plate. But the insurance company said no, and that he would have to take statins for 6 months to see first if they would work, despite his well-documented allergy to statins. It took a significant effort to get the insurance company to finally approve his treatment, and now we are at the precipice of having to petition for it once again. Now, I also have the privilege to speak to you today as a former legislator who served on the healthcare committee in my state, Vermont. And prior to that, I was the community health improvement specialist working for a tri-state hospital system to ready them for the changes of the Affordable Care Act. And in my time in the legislature, the insurers would lobby us and try to sway public opinion with some of the most fear-mongering, illogical opposition to very basic proposals that we brought forth. They would say things like the millions of dollars it would cost to provide contraception for all in a state which actually has a population less than half of that of all of Brooklyn.
Got it right!
As an FYI, for y'all who don't know, that same Blue Cross Blue Shield lobbyist is now in charge of the Vermont State Healthcare Program. So understand that our healthcare is absolutely under attack, and they have people on the inside. So the reality is that the insurance companies know that the programs that would actually guarantee everyone health care, like single payer, are popular. And that's why they're scared of our power.
That's right.
They're strategizing to keep their profits. They are diversifying what they do to move away from insurance and other ways to take over our healthcare system. When we passed single payer in Vermont, the insurance companies fought back and ultimately killed it. But while they have the profit on the line, we have our lives on the line.
That's right.
I want to remind folks that Anthem Elevance made $6.1 billion. And where did that money come from? It came from Lane's surprise bill. It came from Bree getting sick with an obsolete insulin pump. It came from millions of dollars of denied treatments, medicines, and care. It came from your members, your family, your friends, your neighbors getting sicker and sicker and saddling them with loads of debt. That is why we demand that you overturn the open denial submitted by the Care Over Cost, stop denying claims, and overturn any existing denials for treatments recommended by medical professionals. Provide transparency for denied claims and pre-authorizations by market, state, geography, gender, and race. Share that monetary value of the total denied claims and pre-authorizations and give the money back to the frickin' people. We're gonna hold monthly open microphone meetings with members to discuss the problems with your insurance products so that we can make a change and then transfer the claims and appeals process to the public authorities. But we also need to be on those inside spaces too, to ensure that it's actually our public voices. I want to let you know I'm so proud of this peaceful protest because denial of health care is the true violence.
That's right.
It's the true threat, not us raising our voices. So I just want to ask you, when our lives are under attack, what do we do?
Stand up like that!
When our lives are under attack, what do we do?
Stand up like that!
When our lives are under attack, what do we do?
Stand up like that!
Thank you.
When our care is under attack, what do we do?
Stand up like that!
When our care is under attack, what do we do?
Stand up like that!
When our care is under attack, what do we do?
Stand up like that!
When our care is under attack, what do we do?
Stand up like that!
All right, let's give it up for Kaya! And let's give it up for all of our speakers who spoke truth to power, even though these folks were too damn scared to come outside and meet us face to face. What do we do with that, y'all?
Cowards!
We've been here for damn near 40 minutes, and still, Gail and Anthem Blue Cross Blue Shield executives are too cowardly to meet us face to face. Too scared to come down from their tower and face the pain that they have caused, face the hurt that they have caused, face the harm that they have caused. We say that ain't right!
That ain't right!
But guess what, y'all? We're coming back.
That's right.
We're coming back. This is just the start. We are building a people-powered movement to put care over cost. What do we want them to know? That we'll be back.
We'll be back! 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 We'll be back!
turn towards, if folks can turn towards me. Yep. And we're going to start walking towards our buses.